That's why pie crusts were so good back then. Whenever you cook with trans fats, it just has the most crispy, perfect crust ever. But it's just not worth it. I'm going to try not to think about it. Grandma's crust is just so good.
We're not crust to die for.
Yeah. Almost nothing is worth dying for, including trans fat based crust.
So let's talk a little bit about the timeline here. So, 1944, for those that are wondering, is when the Minnesota starvation experiment occurred. So in the 60s to 80s, based on what I was able to find, it's really unclear from those years how much trans fat exactly was in the food supply. But it was probably a substantial amount. And that's, again, around the time that the Minnesota coronary experiments were happening. Also, 1963, we reached our peak cigarette consumption as a nation.
That sounds like a confounder.
This is a big problem. So 1960s is actually the decade where heart attack rates peaked. So you'll hear people with this, pseudo messaging talking about how now people are having more heart attacks than ever. People are having worse heart health. And that's just simply not true. Our prevention has actually gotten a lot better, but unfortunately it still is, the number one killer. And most people will have a vascular event at some point in their life as of the time we're recording this.
Yeah, that's not great odds. And it's one reason why cardiovascular disease prevention and ASCVD prevention should be at the top of your preventive med and health optimization list. Your car's not going to care if it has a turbo if all the systems clog and die. And you can't just put a new engine in a human yet. So that's some things to think about. Anyway, 60s to 80s, trans fat peak. That's why pie crusts were so good back then. Whenever you cook with trans fats, it just has the most crispy, perfect crust ever. But it's just not worth it. I'm going to try not to think about it. Grandma's crust is just so good.
We're not crust to die for.
Yeah. Almost nothing is worth dying for, including trans fat based crust. So 1963 was peak smoking. 1964 was the first public announcement that cigarettes are harmful. That's wild. That's so recent.
Yeah, I mean, this is around the year that my father was born. Looking back, baby Dad O'Hara, that's about the time that we realized, maybe we shouldn't be telling people to smoke or that smoking is harmful. And like you mentioned, this is a huge confounder if you're looking at all the swaps and changes that happened in a public health sense at the time. So you have at the same time this push towards, again, 1960s, 70s, 80s, a push towards not smoking, a push towards more heart healthy oils, which in that time frame may not have truly been more heart healthy. And then it's just kind of, confounded all the data. So we don't know exactly what public health change is associated with which outcome. Fortunately, I suppose we could say fortunately for the data, not fortunately for the people. Fortunately for the data, the first statin was not invented until 1987, at which time you see a dramatic drop in rates of vascular events.
Because they were dropping dead of other things before they had a vascular event. So that's interesting. Of course, we know that statins poison your testosterone supply. They might decrease your total tetestosterone by up to 10
nanograms
probably
per
just
deciliter.
5 nanograms per deciliter. So your total of 245 might go down to 235 with a statin.
And that's with the high intensity statins. So if you're looking at there's very few people who in today's society with the options we have available would really require a high intensity statin, especially if you're looking at someone for primary prevention that is concerned with their testosterone. So you can use a moderate intensity rosuvastatin plus Zetia or ezetimibe and get a very dramatic lowering and the same outcome data as if you had someone on a high intensity statin. There's also the PCSK9 inhibitors. There's just a ton of options there. So
those are definitely great options. Bempedoic acid now, and there's multiple non-lipophilic statins. There's a lot of good options for primary prevention of atherosclerosis, but just taking a statin doesn't mean you still can, but should you eat as much saturated fat and seed oils in your diet as you'd like? Obviously not.
Yeah, I suppose it will help from the atherosclerosis standpoint, but if you become like diabetic enough or smoke enough or hypertensive enough,
Yep.
then all bets are going to be off. And as we saw, like perhaps with more saturated fat, if you're inactive at high risk, you could develop more fat in the liver more
Yep.
quickly from more saturated fatty acids.
Yeah.